Okay, we're ready to talk about directional terms. So what directional terms are we going to use in anatomy? First, we have superior versus inferior. Okay, superior, closer to the head, inferior, closer to the feet. And just a quick reminder, whenever you see these notes right here, that is what is on the note sheet you're going to be given in class. Then we have cranial versus caudal. So these mean the same as superior and inferior. So a way to remember it is cranial, cranium, closer to the head, and then caudal is the feet. We have anterior versus posterior. Anterior closer to the front of your body, posterior closer to the back of your body. And then just like that, we have two alternate terms, ventral versus dorsal. Ventral closer to the front, the belly side, dorsal closer to the back. I always remember it like this. Sharks have a dorsal fin on their back, so that's dorsal, ventral. So ventral and anterior, or posterior and dorsal. And then we have proximal versus distal. The interesting thing about these two terms is we can only use them on limbs, so arms and legs, and only when we're talking about the same arm and the same leg. So I could say this finger is distal from this shoulder, okay? So distal and then proximal. So as we move closer to where the limb attaches to the trunk, we call it proximal. As we move further away from where the limb attaches to the trunk, we call it distal. Distal, proximal. Distal, proximal. We have lateral versus medial. Medial closer to the midline, lateral further away from the midline. We have superficial versus deep. Superficial, close to the surface. Deep, further away from the body surface. Right versus left. So however you remember what's the left side and the right side, what you always need to remember is that the body that you're looking at in any diagram is always in anatomical position. And you talk about the right and left in reference to that. Always. Here's a quick overview of most of those terms. You can check it out. Let's talk about a couple of challenge terms. So if you want to delve a little deeper, two terms, ipsilateral and contralateral. So ipsilateral means on the same side of the body. So your right arm and your right leg. Or you could say contralateral, they're on opposite sides of the body, your right arm and your left leg. And then we have unilateral and bilateral. So unilateral is on only one side of the body and bilateral is on both. So you could have unilateral pain. So you only have pain in your shoulder on one side, or you have bilateral pain, pain on both sides. How do we use these terms? Here's an example. The orbital region is superior, lateral, posterior to the nasal region. The carpal region is inferior, lateral, distal. Remember, you always think about the body in anatomical position, so there should be no questions. Now let's look at body cavities. So the functions, they protect organs, they cushion our organs, and they allow changes in the shape and size of organs as we digest food, as we breathe, and as our heart pumps. So we have the cranial cavity and the spinal or vertebral cavity. Those are both dorsal cavities on the back. We have the ventral cavity, which has the thoracic cavity with our heart and lungs, and the abdominopelvic cavity, which further divides into the abdominal and the pelvic. That's not shocking, listen to the names, right? And the abdominal cavity, most of our digestive organs and our kidneys, and the pelvic cavity has the bladder, reproductive organs, and the rectum. Together, abdominal and pelvic make abdominopelvic. And we have the diaphragm, that's the divider between the thoracic and the abdominopelvic cavities. We do have other body cavities like our oral cavity, nasal, orbital in our middle ear, and in our joints, which is the synovial. Now let's look at the abdominopelvic cavity in greater detail. We're going to divide it into quadrants. So let's look at these quadrants. We have the right upper, the left upper, the right lower, and the left lower. Remember, always assuming the body we're looking at is in anatomical position. And the information, the organs you need to know are right here. So hepatitis, if you're experiencing an inflamed liver, that will probably be right upper quadrant pain. Appendicitis, right lower. Okay, so the ones on the screen are the only ones I'm going to ask you. And then we have one last thing. You would have to describe the oral region. So here's an example. The oral region is medial to the buccal region. That's one example. You have to describe it using 3 different directional terms. And there you have it.